Thank you to Jen from Shore, a medical technologist and nursing assistant at Good Samaritan Hospital in West Islip. Thank you to Isaiah from Hempstead, an emergency department nursing technician at LIJ Valley Stream. Thank you to Michael and staff at Veterinary Emergency Group, and a shout out to Jennifer, who made the masks you see here in the picture. Thank you to Sylvia, who just graduated CW Post on May 8th, and is now working as an RN at St. Francis Hospital. Thank you to Rhea from Elmont, a lab tech at Northwell Health Laboratory. Are you an essential worker or know someone who is? Then we want to hear from you. All we need is the picture, the person's name, the village or town, and what that person does for a living. Every night, right here at 7, we will be thanking the people who have been on the front lines during this pandemic. Just go to the News 12 Facebook and Twitter pages. Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Plainview and Syosset Hospitals to help you sort through what's going on with COVID-19 in our communities and across the region. And every night, we want to hear from you. This is a call-in show, so please call in 516-393-1800. Well, 5 of the 10 New York regions are beginning to reopen the economies today. Long Island, we're not one of them. We're going to stay on pause. Today, Governor Cuomo extended the stay-at-home order through May 28th for regions that do not yet qualify for reopening. Cuomo also announced state and local beaches statewide will be able to open partially for Memorial Day weekend. He says there will be a 50% capacity rule, and visitors have to wear face masks everywhere except on the sand and, of course, in the water. Now, the governor says we're starting to turn the activity valve. Those are his words. That's his analogy. The activity valve on. So we have to watch what happens to the infection rate. Statewide, the number of positive cases, look at it right there, just under 346,000. Nassau Executive Curran says a little more than 5% of people being tested in Nassau are positive for the virus. Suffolk Executive Balone says although cases are declining, they do continue to see between 150 and 250 new cases. That's every day. And the statewide death toll, I mean, just staggering, a little more than 22,300. Now keep in mind, this is just at the end of February this began. One metric, Nassau Executive Curran says Long Island still needs to reopen, is that 14-day decline in the number of deaths. She says we have not yet met that benchmark. Nassau and Suffolk have lost more than 3,700 residents from COVID-19. All right, let's get right to our discussion right now. Joining us tonight is Dr. Melissa Cusumano, an emergency medicine physician at both Plainview and Syosset Hospitals. Thank you so much for taking the time, and thank you for everything that you do every day for us. You really are one of our heroes. You're on the front lines, and we appreciate you and everything you're doing. Let me start off by asking, how are you doing? How are you and your colleagues doing?
We're doing okay. Every day seems to be getting a little bit better. As long as everybody keeps practicing social distancing and following the guidelines, hopefully this number will go down, but we're all hanging in. Thanks for having me too.
Yeah, no, and that's an important point that you're making, because as our economy statewide, I mean, it's mainly upstate right now that are opening up right now. In the 10 regions of New York, 5 of them are starting to reopen. It's still important to keep that social distancing and to wear masks in public, right?
Definitely. We don't want to have a resurgence of the virus. We all want to stay healthy, and we all want to go back to our normal lives. So if we can do it cautiously and slowly, I think we can, and we work together, we can get there. Okay.
Let's get some of the questions in. Jamie from Wantagh. Jamie, you there?
Yes. How are you?
Thanks for calling, and what's your question?
Yeah, just quickly. My 10-year-old son was recently diagnosed with a rare skin rash called pleva. About 3 weeks prior to that, he was ill for about 10 days with an unknown virus. I was wondering if you thought that this rash could be the result of COVID, and additionally, if you know of any physician that can effectively treat or cure pleva.
It's hard to see since the symptoms were they developed back in December. We weren't really looking for COVID. We weren't aware of it at the time, so we couldn't really say if that could be the diagnosis of your child. You could have an antibody test to see if your child made antibodies. That might kind of help you along the way, kind of guide you, but there's no definitive answer as to whether or not that rash could be specifically related to COVID. And as far as the rash is concerned, the best thing to do would be ask your pediatrician for a dermatologist referral.
And right now, Doctor, isn't it true that like telehealth has become much more popular, so people can actually just talk to their physician via the internet?
Yes, that's actually been a very helpful way to see patients, especially with something like a rash. It's visual, so that might be a way for you to stay safe and also possibly get a diagnosis for your child.
Okay, let's get Greg from Seaford. Greg, you there?
Yes, hello, Stone.
How are you?
I'm here. Good, thank you. My question is, are there any plans to coordinate the flu vaccine in drugstores this fall?
I'm sorry.
Yeah, I don't know if you can answer that, but
To what with the flu vaccine? I'm sorry.
coordinate it with drugstores for the fall?
I
don't know, but is it more important to get the flu vaccination this year than in previous years because of the potential of a second wave of this COVID-19?
Flu vaccines are very important, yes, and I think everybody should have one, especially if you're at high risk. Obviously, as the flu season starts to kick in the early fall, that would be the best time to get your flu vaccine.
And that might complicate things, right, in the fall if we have another wave of COVID-19 and it coincides with the flu season, people having the problems of trying to distinguish between the two?
That's true. I mean, luckily we can test for the flu and we can test for COVID now. So, hopefully we won't see a resurgence of both, but the flu season is always there. And unfortunately, it looks like COVID will have our COVID season as well.
Yeah, unfortunately. All right, let's head out to Melville. Joe, are you there?
I'm here. Thanks, Stone.
All right, what's your question tonight?
All right. Thank you, Doctor, too, for taking your time. My question is, I know this new strain is affecting children, and I've noticed that children really don't wear masks, and my granddaughter does have Turner syndrome. My question would be, should children be wearing a mask, and if so, is there a specific type of mask that the children can wear?
That's a great question. Yes, children should be wearing a mask. Everyone should be wearing a mask. Doesn't matter what age you are, especially if you're outside and you are around other people. Obviously, with practical social distancing. Considering your grandchild has an underlying health concern, it's even more important for him or her to wear a mask. And they do make smaller sizes for children. So that's definitely something your child should be doing.
Okay. How about Maddie in Mineola? You there?
Yes, I am. Good evening. So I'm asthmatic, and I wanted to find out if you could differentiate for me the difference between a tight chest when you're asthmatic and that when you are having an attack from coronavirus. Thank you.
Oh, well, that's a good question. Most asthmatics, when they're symptomatic and they have their chest tightness, a lot of times it feels the same. They notice it with certain triggers, whether it's allergies or exercise-induced. I would say that any kind of tightness that seems to be more persistent and longer lasting would probably be a concern for me if it didn't feel like my normal asthma symptoms.
Okay. How about Jean from Riverhead? Jean, you there?
I guess I am.
What's your question tonight?
All right. My question is, I have a daughter who's a primary care physician in New York City. She tested positive for COVID-19 2 months ago, tested negative for antibodies last week, and just wanting to know, we are in our 60s, and when is it safe for my daughter and her husband and my granddaughter to visit our house and stay with us?
Thank you for your question. I would say that that's tricky. Your daughter is still exposed to the virus. If she's a primary care physician, I'm sure she's still taking care of COVID patients. That would be something to discuss between you and your daughter. If she felt safe enough to come out where she can keep distances from you and your grandchild, that would probably be more of a family decision. It's hard to say how long the virus lasts. Everybody is different on every case is different. But more importantly, I think it would be important to discuss that with your daughter.
Now, since you're right there on the front lines, you're exposed every day, much more than the average person. How do you balance that yourself for the viewers, staying safe, your family life, and the fact that you are exposed?
It's tricky. It's difficult. I have to say, I have a very supportive husband who helps me along, kind of to make sure that we keep the house sanitized, and I have a protocol as to when I come home from my shifts, how things get cleaned in the wash, and washing hands, going immediately in the shower after a shift, trying not to contaminate things, wiping things down with Lysol or Clorox, and just trying to stay safe. It's tricky.
Yeah, I'll bet it's tricky. It's tricky just for us. I'm sure it's doubly and triply tricky for people who are actually exposed on a daily basis in a long period of time. We're going to take a real quick break. When we come back, we're going to have much more expert advice on how to keep you and your family safe from the coronavirus. Remember, we do want to hear from you. It's a call-in show, so call in. That number right there at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Melissa Cusumano, an emergency medicine physician at Plainview and Syosset Hospitals. Doctor, let me ask you this. I know that remdesivir, it's not a cure, it's not a vaccine, but it does seem to at least advertise that it helps with symptoms. Are you seeing that in your hospitals?
Yes, we are. We've started to use it in our more critically ill patients in our ICU. Probably in the last week or so, it's become part of our protocol.
Okay, and is there a shortage? Because we're hearing in some places there are shortages, some places say that they have plenty.
As of right now, from what I know, we have enough. I can't speak for other facilities, other health systems.
Okay. All right, let's go back to the phones, get some questions in. Amy, are you there?
I am here. Thank you for taking my question.
Mm-hmm. What's your question tonight?
Yes, hi. I'd like to know, I'm curious about the safety of blood transfusions since the coronavirus.
Oh, should we be worried, doctor, about transfusions?
That's a good question. Thank you. We shouldn't, as long as we've been doing transfusions. We have safety protocols in place so that if you needed a blood transfusion, it is safe.
Okay. What about, let's see, Nikki from Deer Park. Nikki, you there?
Yes, I'm here. Thank you, doctor, for your service and your time. My question is, how many days prior to showing symptoms are you contagious?
That's a good question. So, on average, there's no specific number. Anywhere, I would say, from 7 to 14 days. That's why we encourage the 14-day quarantine if you thought that you might come into contact with somebody who might have the virus, that up to 14 days this virus could be transmitted.
Wow, that's okay. Maureen from Merrick, you there?
Yes, I'm here. Thank you for taking the call and taking our questions. I'm 68 years old, and 2.5 weeks ago I got tested for the antibody, which came back negative. In the beginning of June, I'm scheduled for a hip replacement. Would you advise doing it at this time, or should I hold off? And should I go to a rehab or possibly even subacute rehab if needed, or should I just wait a little bit longer?
That's a good question. We are doing elective surgeries now at a lot of our facilities in the Northwell system, and we are swabbing all patients for COVID prior to their surgery. And like in an operating room, there are standard precautions that they take. That's something that you would need to discuss with you and with your orthopedist, but we are making sure that everybody is swabbed prior to surgeries at this point. And I would say for the rehab, that would be something that you would need to investigate with each rehab facility as far as what their protocol is for the COVID virus.
Okay. What generally kind of advice would you give to Long Islanders who might be hesitant to come into a hospital at this point or an ER department for fear of contracting the virus?
Well, that's understandable. Every emergency room practices, everybody has to wear a mask. Everybody's wearing personal protective equipment, at least on our end. It is safe to come to the emergency department. We will see you for any of your complaints. It is a safe place to be, and we will make sure that you are protected.
Okay. Let's go to Bruce from Holbrook. Bruce?
Yes, thank you for allowing me to speak. Dr. Cusumano, I'm a fellow Northwell employee, so thank you and all the healthcare workers out there, frontline workers, fighting the virus. So thank you. The question is, with our grandchildren, we've been distant for some time. We're getting together. They've been quarantined pretty much in the house, secluded. We've been secluded. Is it safe to be with them, hug them, get close with them, stay with us? And secondarily, second question, if I may, if you have any information on the Pepsid study that's in progress.
So I would say that if you're going to be around other family members, I would still maintain social distancing and wearing a mask just for the safety of everybody. You never know. This virus is a very silent virus. We can't really detect who may be a carrier or not. So I think the safest thing to do, as much as you may want to hug your loved ones, as of right now, seeing them and maintaining the social distancing and wearing masks is probably the safest bet. And I'm sorry, I missed the second question.
He was asking about the Pepsid study, if you were aware of that.
I don't think we have enough information on that yet. They're still studying the effect.
Okay. I don't know if we have time to take Cheryl, but I do know what she's going to ask. This is Cheryl from Freeport. I apologize, Cheryl, but I'm going to ask your question for you. Negative viral test. She tested negative for the viral test. She tested positive for the antibody test. Should she see her doctor?
Really, all we know is that the antibody test says that you had exposure to the COVID virus. As far as what that means and what your resistance is to the virus, there's still not enough information, but it's something that you can discuss with your doctor.
Yeah, and telehealth is very popular now, so that's a good thing. We unfortunately have run out of time. I want to again thank you, Dr. Cusumano, for everything you're doing, for coming onto the show and talking to Long Islanders about stuff that we don't know anything about. You're the experts. You're on the front line, and for everything you do every day on behalf of me and for News 12 and for everybody on Long Island, thank you so much. And thank you to the viewers. Thank you for watching, and thank you for your calls. And we'll see you right back here Monday night at 7. Stay safe.